talk about the role that weight management, exercise, and nutrition play in overall survivorship. There's not going to be a lot of time. I have tons of studies that we could talk about, so I'm going to try and keep it brief. The reason I love this topic so much is that what we put into our bodies and how much we get our bodies moving is something that we have control over. Despite that, it's so easy to not do anything, to put the wrong things in, to not think about what we're eating, to not be active. When I decided that I was going to incorporate nutrition and lifestyle changes into my life, or nutrition and exercise changes into my life, I literally had to sit myself down and make a list to convince me that it was worth doing. And when I made that list, that's when I realized that there are so many important reasons to think about what we're eating and how much we're moving and how much physical activity that we're actually getting. We know that during adjuvant treatment for breast cancer, women are prone to weight gain. In fact, as many as 50 to 96% of women gain weight during their adjuvant treatment. Those weight gains are anywhere from 5 to 13 pounds. However, we've seen weight gain as much as 22 pounds. In addition, we know that weight gain actually is linked to decreased overall survival. And women who, even if they don't gain weight, we know that they undergo body composition changes and tend to have an increase in their overall body fat mass. That's important because estrogen's actually made in our body fat and stored there. Finally, we also know that women who are undergoing treatment or after a diagnosis are about 30% less active, which is about 2.5 hours per week in decreased activity. So a couple studies that I did just want to touch upon. One is called WINS, the Women's Intervention and Nutrition Study. This is a study that looked at the role of dietary fat. It asked women to decrease their dietary fat by 15%, or down to 15% of their overall caloric intake. After 5 years, it actually found that women have had a 24% lower risk of breast cancer compared to the control group. In addition, they found a 6-pound average weight loss. Another study called the WHEEL study, the Women's Healthy Eating and Living study, asked the intervention group to increase their intake of fruits and vegetables. This was what they would call isocaloric study, so that there was no specific decrease in calorie between the groups. There were 3 arms in this one. But they asked them to increase the fruits and vegetables. And then they also asked them to do a moderate activity, which was the equivalent of walking 6 days a week, 30 minutes a day. They found that those who were physically active had a 50% more likelihood of survival, of a 10-year survival, which is significant. In addition, the HEAL study looked at activity level in women 1 year pre-diagnosis and 2 years post. And it found that women who participated in any level of moderate physical activity had an overall 64% lower risk of death than inactive women. There are tons of other studies. Some of them are randomized controlled studies. Some of them are observational studies looking at exercise. And overall, we're seeing that higher level of physical activity before and post-diagnosis is associated with an overall improved prognosis in breast cancer patients. The exercise studies have also examined the role that exercise plays in weight loss, mood changes, body composition changes, quality of life, and hormone levels. I'm just going to give you kind of a few quick points. Again, can't really elaborate on all of them. The studies definitely show that women who exercise report overall improved quality of life, a huge issue for survivorship, less fatigue, another huge issue, especially post-chemotherapy, more positive attitudes about sexual attractiveness, and improved mood states. In addition, when exercise has resistance training added into it, it improves overall cardiorespiratory fitness, body composition, and can increase lean tissue mass and decrease fat mass. And it may specifically promote loss of fat in the abdominal cavity. Physical activity of 150 to 250 minutes per week can prevent weight gain and even promote modest weight loss. Physical activity greater than 250 minutes per week can actually significantly impact weight loss. There's one other thing about diet that I just want to put out there. This isn't a study that was specific to breast cancer, to survivorship, but I think it's applicable to modern day. There was a huge study in the New England Journal of Medicine that it had 4 arms, and it compared varying percentages of fat, protein, and carbohydrates. So it was trying to answer the question, is the South Beach better than the Atkins, or the Jenny Craig better than Weight Watchers, all that kind of stuff, which is, I think, something we all want to know, right? So they didn't follow any of those diets specifically, but there were 4 arms with varying percentages. And interestingly, it told us that it didn't matter which arm you were on, as long as you decreased calories, you lost weight, and that one arm didn't have a better outcome than the other. In that study, in 2 years, 15% of the people actually lost 10% of their initial body weight. And none of these were really dramatic. They were all within, I would say, anywhere from 5 to 15 percentage points between the groups. In addition, all 4 arms showed improvements in lipid-related risk factors and in fasting insulin. So in this short amount of time, I realize I've just kind of thrown a whole bunch of facts out at you, and I'm leaving you with the most difficult task of them all, which is to figure out, how does this play into my life, and what am I going to do with this information? And so I encourage you to sit down and think about what's important for you in survivorship, and to use some of these facts and empower yourself to make a list that either encourages you to maintain the healthy lifestyle choices that you're already participating in or doing, or to make some changes. And here's number 1 and number 2 kind of things that could be on your list. Number 1, there is really no specific breast cancer diet, but preliminary data really says that suggesting eating a low-fat diet and possibly a diet high in fruits and vegetables may reduce the risk of cancer reoccurrence. And indeed, with a caloric restriction, if it's appropriate, can promote weight loss. And then the second one, physical activity and exercise. Again, women who exercised at least 3 hours per week, moderate intensity, had up to a 50% lower risk of breast cancer reoccurrence and related death compared to inactive individuals. And thus far, it really looks like irregular exercise is the best single predictor of weight maintenance. So that's all. I'm happy to answer some questions. Thank you.